Okay. This is another pubic pattern that I'm starting to pay attention to. In the presence of a symmetrical pelvis, including pubic joint, I'm questioning if there is the possibility of the lower pube being separated. And I have seen that in some recent x-ray images where it's very distinctly much more separated than the norm, okay? And so what I submit is that in this type of a person, if we were to do a sideline spring through the ilium, it would probably be at end range because the upper pube is compressed and the lower pube is separated. So because it would be at end range of compression here, then I don't think that we would have spring mobility here. Now, I'm new to this, so I'm just starting to experiment. And I guess really ideally would be actually instead of, finding the lateral brim of the pelvis and actually coming down almost to the midpoint and springing, from the left to the right here, and then doing the same thing on the other side. It's so new to me. I don't have data, but I feel compelled to share it, okay? The other thing that we could do is in sideline, spring the lateral ischium, okay? And because it seems to be at end range of distraction, it's my belief that it wouldn't spring medially. Again, I don't know. And the other question is, if this ischium is at end range, both of them, of being laterally distracted, then I should think that there would be no external spring also. So anyway, there's that pattern. I'm experimenting with it. Again, I hope to have more data later. And the treatment that I have used for this is to have the person lay on their back. And let's suppose I want to close the left pubic bone into the lower fibrocartilage. Well, I would bend the right hip and knee and take the foot over to the left side to create room, pretend this is their femur on the left, so that I can adduct the femur, okay? And I just let it roll into external rotation or internal, whatever it wants to do. I don't really care. I just want to adduct it to an end point with very mild pressure and sustain that pressure for 3 minutes. And then I would do a similar treatment on the right side. And so if you should have any experience with that, I would be so grateful for feedback, and same with the prior pubic pattern. Thank you.